Thank you, Madam Chair, and thank you, Select Committee, for allowing me to speak to my submission today. I am a New Zealand trained and registered medical doctor, wife and mother of 3 children, and I'm deeply concerned about the bill in its current form. My submission highlighted a number of areas of concern, in particular that the bill appears to mandate a sole gender affirmative treatment model. My submission explained in detail, however, that there is a lack of scientific evidence to support this model, let alone mandate it as the only and best type of treatment for all. And today I've decided to focus on the first stage of gender affirmative treatment, which is social transitioning, and the impacts of applying the bill to this area. Social transitioning usually involves a child using the preferred personal pronouns for the gender they identify with. This gender affirmative option may seem very favourable to a child wanting to quickly relieve emotional distress. Children are particularly vulnerable to short-term gratification. But just because a child wants something, it doesn't always mean it's in their best interests. UK community paediatrician Dr. Julie Maxwell states using names and pronouns could, and I quote, solidify that gender identity in the mind of that young person. And we know from studies that the vast majority of children with gender dysphoria will of course grow out of it. We shouldn't be doing anything that might prevent them from growing out of it. It could very clearly be argued that using names and pronouns could be one of the things that actually pushes them one way or the other, end of quote. She states she would definitely counsel parents against using a child's preferred personal pronouns in certain situations. So, does the bill have the potential to mandate our young people start on a path of social transitioning that could lead to puberty blockers, hormones and surgery for a dysphoria that they may have otherwise outgrown, a pathway that could cause serious irreversible harm? Does this bill give children and their families any other choice? I would say, no, it doesn't. It only supports the gender affirmative approach. And the concerning thing for me is, unlike puberty blockers or hormones where the decision is made within the privacy of the doctor-patient relationship, social transitioning involves anyone in the community who communicates with that child. I'd really like the Select Committee to consider whether family members, friends, or even the general public would be considered as taking part in a conversion practice if they refuse to use a child's preferred personal pronouns when a child demanded this. What if their doctor deemed this to not be in their best interests? What if the child hadn't even seen a doctor for advice yet? How would the law be applied, for example, to teachers using preferred personal pronouns for a student unbeknown to the parents? Are teachers even aware that by doing this, they're participating in the first step of gender affirmative treatment, and that there are no good studies, to my knowledge, to support this form of treatment? Does the bill protect anyone, including the online community, just because they assist a young person along a gender affirmative path, even though they may not know that young person's other medical or psychological history? This to me is dangerous and nonsensical. Can I also ask this? What gives the government and the Ministry of Education, for that matter, the right to push my child onto a medical pathway that has no significant scientific evidence and that could actually cause significant harm and distress? And not only that, but put me in prison just because I want the best for my child and don't want them experimented on. I feel there are just too many uncertainties in how this bill can be interpreted and implemented, and that's probably one of the reasons you've received so many submissions. New Zealanders, the people your committee is supposed to represent, are angry, confused and scared. You tell them they're safeguarded from criminalisation, but they're just not sure what they can and can't do. This bill has to make it clear that a wait-and-see approach with access to appropriate psychological support is legal for our young people, as we just don't have the evidence to mandate a sole gender affirmative approach for all. Lastly, if the intention of this bill is not in fact about pushing a particular political agenda, but rather protecting people and giving them options, then please rewrite it so that all New Zealanders can interpret without a doubt what a conversion practice is and isn't. And please ensure that all people are able to receive individualised psychological treatment that is most appropriate to their health needs. Thank you for considering my suggestions.